Hey, it's Chung from adultspeechtherapy.co. I'm a speech language pathologist, author of the Adult Speech Therapy Workbook, and a university instructor. Today I'm going to review executive functioning disorders, specifically how to use strategies to treat executive functioning disorders from severe to mild. This video is for speech language pathologists and other speech therapy professionals who are looking for effective but easy and quickly to implement techniques to help their patients who have executive functioning disorders. Visit our website at adultspeechtherapy.co for even more ideas on functional cognitive tasks. Well, let's get started with a quick review of executive functioning. It covers goal-directed behaviors. You may have heard that term before, but what does it mean? Executive functioning are things like planning, problem-solving or generative thinking, reasoning, initiation, drive and persistence, response inhibition, organization, and awareness. So pretty much all the things you need to get stuff done, from going to the bathroom or planning your next cosplay outfit, require some executive functioning. So it's important to work on, and how do we do that with our patients who have severe disorders? Strategy number 1, use task analysis. Break down those tasks, even simple ones like using the call light, into separate steps. So for the call light, seems like a simple task, but not necessarily if you have an acute brain injury. You could break down that task like this. Step 1, know why you need to call the nurse. Go to the bathroom to help get up, whatever. Step 2, find the call light. Step 3, push the button. And step 4, remember why you needed to call the nurse. So you could practice those steps using strategy number 2, errorless learning. Accuracy is key for learning, so give plenty of cues so your patient doesn't guess. Provide positive reinforcement when they do get it right. You could also practice these steps by using strategy number 3, a high number of practice trials. So do that call light task, those 4 steps over and over again. The more your patient practices accurately, the easier and more automatic the task becomes, freeing up some of their cognitive load so they can focus on other important things like what's for lunch. Another strategy is to make environmental modifications. Again, free up some of that cognitive load. The fewer distractors that are in the room, the better it is for a patient who have severe cognitive impairments. You could reduce clutter or at least clear some of their tray. Make sure their tray is always clear. Ask your colleagues to always return the call light in the same location, like right next to the patient's dominant hand. Have a brightly colored piece of paper with an image of a call light on it and a friendly reminder to use it. All these things are really simple, but they can be really effective. Now let's switch gears and talk about mild executive functioning impairments. Your patient is able to plan, organize, inhibit their responses, persist through simpler tasks in certain environments, but they're still not quite at previous level of functioning. So you could use those same set of strategies that you did with your patients who had severe disorders, but with more complex tasks like financial or medication management. So let's use the example of medication management. Your patient is on a few new medications because they just had a stroke. It's hard for them to know where to start with all their new meds. So use that strategy number 1 again, task analysis, and teach them step by step how to sort all of their medications into a pill box. For example, step 1, gather all your medications and your pill box. Step 2, grab one bottle, read the instructions. Step 3, follow the instructions and fill out your pill box. Step 4, double check your work. Step 5, set the bottle to the other side and pick up the next bottle and continue on. So use that task analysis. And use errorless learning and a high number of trials to help them be as accurate as possible with this task. This can also be a great time to add in metacognition or self-awareness training. You typically do this with patients who have moderate to mild disorders and not so much severe disorders, because those patients need more of a cognitive foundation from which to build up awareness. And you typically have bigger fish to fry with those patients, like help them make sure they stay physically safe. So how do you increase awareness? You can use what we call the game plan worksheet, which is available for free download on our website. But what it essentially asks is for the patient to predict how they're going to do on certain tasks. They'll also anticipate when they believe they may run into trouble, and then to make a plan to help them get through those times. It also asks them to self-monitor during those tasks, to use a plan as needed, and then review how they did and compare it with their prediction. So you usually start this with a task that they have either practiced before or similar to a task that they recently completed. so that your patient has some other task to predict and compare to. So let's put this example of medication management and how to increase self-awareness in that. So you can introduce the task. Here are 5 pill bottles and your pill box. If they're in an acute setting, you could use different colored beads instead. So here are your pill bottles. Here are your instructions on how to do it. The task is to fill your pill box as accurately as possible using the instructions. How do you think you'll do? And then the patient discusses it and then writes down what their prediction is in the game plan worksheet. Then you ask, where might you get stuck or have trouble? You could refer them to the instructions as needed. They could write down their predictions, at least one of them. There should be at least one point where they may run into trouble, because if they're doing totally great in the task, you wouldn't be working on it in therapy together. So if your patient has a hard time coming up with one idea, you can refer back to those similar tasks or similar times they had trouble. Then you can ask, what can you do to help get you unstuck or to move on with the task? So for example, your patient knows they do well with the first few minutes of the task, but then their attention slowly starts to slide. So a plan could be to use an attention strategy like self-rehearsal or reading the task out loud to help them reattend. Your patient then starts the task and you give them cues to be as accurate as possible. When they get stuck or have trouble, prompt them to use their plan, like using those attention strategies. After the task, you can thank them for their hard work and ask, how did you do? And they could write down their prediction on the game plan worksheet. Finally, they can compare their actual performance with their prediction that they did at the beginning of this task. If they predicted correctly, great, give positive reinforcement. If not, then further discuss what they missed. Keep it light, keep it positive. In summary, some effective evidence-based strategies to use with your patients who have executive functioning impairments are: use task analysis. Break down those tasks into smaller steps. Use errorless learning. Focus on accuracy and give as many cues as needed. Use a high number of practice trials. Use environmental modifications like reducing clutter. And increase self-awareness through task prediction, like using something like the game plan worksheet. I'm Chung Brewer. Thank you so much for watching. Once again, we have a free PDF for the game plan worksheet at adultspeechtherapy.co. Just use the search box to find articles about executive functioning. See you next time.